Welcome to Clyde's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Dr. Robert Sawyer, the co-director of the stroke program at the Gates Vascular Institute. May is Stroke Month, and in this episode, we'll be discussing stroke awareness and some of the latest advancements in the treatment of stroke taking place right here in Buffalo. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Sawyer. Thanks for joining us. Always great to have you. We're here to talk a little bit about stroke, and May is National Stroke Month. So if you can, let's just start out by telling us a little bit about stroke, what it is, and how someone may know if someone is suffering from that type of episode.
Okay. Stroke is number 5 killer, but it's the number 1 disabler in our country today. So people who get strokes, we can't fix the brain. And so they end up with disabilities for the rest of their life, which is really what this whole program is about, is to reduce the load of that disability and make sure that we do everything possible to not only stop a stroke in progress, but also prevent strokes in the future.
Sure. And you said it's the number 5 in terms of ranking
mortality.
Order.
Yeah.
So how many people suffer from a stroke across the country, and then what's that look like here in Western New York?
It's a huge number of strokes across the country. In Western New York, I can mostly just tell you facts and figures about our institution.
Program, sure.
We see probably 2,100 strokes a year on average,
and that's the
year in,
program,
year out.
That's the largest program in the state.
It's the largest program in the state, and we're probably number 3 in the country.
Sure.
We have quite a few strokes in this area. Biggest risk factor for stroke is just getting older. We have an aging population. We have a population that doesn't have the best diet, and a lot of people smoke.
Sure.
And those are all risk factors for stroke, along with hypertension, diabetes, and lipid problems.
Sure.
And that kind of adds up in the population. And that's so aside from the stroke belts down south,
right.
Buffalo is it.
Yeah.
it's a center.
I've seen the map where almost like a heat map where upstate New York and then particularly Western New York, seems to be a hot spot for that.
Yes.
A lot of that again is diet related, health style related, correct?
Yes.
Yeah. Okay.
Yeah.
When I was growing up, there was an awful lot of awareness about people who may have suffered from a heart attack and learning things like CPR. Stroke seems to have emerged quite a bit in the last decade, maybe 20 years, as to you need to know the signs and symptoms. So if you can first talk a little bit about that evolution of stroke becoming such a hot topic, and then we can get into signs and symptoms.
We're about 15 years behind cardiology.
Okay.
In terms of treating strokes. And there's a few reasons for that. But if you have a heart attack, generally what's going to happen is if you're within 2 hours of a center that can provide what's called PTCA or cardiac catheterization, sure. You go straight to that. You go straight to that center. If you're more than that, you'll go to a local center where they can give you something like tissue plasminogen activator or TPA, mm-hmm. and then you're shipped on to definitive care. Those centers look at door in, door out times, how fast they can treat the patient, and when they hit here, they have a time limit of less than 45 minutes to get them up on the table and treated right away. Stroke is like that, except that we have not separated TPA and thrombectomy. So the people who do best are large vessel occlusion strokes who get both TPA and they get what's called thrombectomy, which is performed by the UB neurosurgeons here at this hospital. So
is that's an invasive procedure plus medication? Is it just medication?
It is
just
medication.
Explain a little bit more what that means.
So if somebody has an acute stroke, They come in within the 4.5-hour window. They will get TPA, which is essentially, it's called alteplase, and it reduces the amount of clotting in your blood. So it basically thins out your blood so much that we can disrupt a clot in situ.
Sure.
But then furthermore, they go on to a mechanical thrombectomy, where a snare is essentially run up into the brain, into vessels, and a clot is pulled out.
Sure.
It's a pretty amazing thing, and our results are just absolutely amazing. If we get somebody within 2 hours, their chance of having a perfect outcome is extraordinarily high. So the number needed to treat is only 2.6.
Right.
That's incredible.
Right.
That's incredible. And even if they're late, so say you have a stroke up to 24 hours, 36 hours, given the right circumstances. So if somebody's kind of cooking along, what we can do is just go ahead and we skip the TPA. We just go straight to the thrombectomy, and we can help those people. The worst situation is they go to an outside facility and they treat them with TPA, or they're too late for TPA,
Sure.
and they don't consider them for thrombectomy,
Right.
and don't move them along to a comprehensive center. Those are people that should be treated, and we're not quite getting to yet.
Gotcha. So as a community, we need to work better in terms of the coordination.
In terms
and
of awareness,
collaboration.
and in terms of just getting those people to the hospital.
So you mentioned cardiology being, say, 15 years ahead of the stroke world. I've often heard stroke described as kind of the heart attack of the brain. So if you can, talk a little bit about what actually is a stroke, and then what are signs and symptoms?
Sure. So a stroke is loss of blood flow to a particular area in the brain, and it can happen for many reasons. There's ischemic strokes, which is what we're talking about. That's about 85% of strokes, and hemorrhagic strokes, which are head bleeds, and that's about 15%. So most of our strokes are ischemic strokes. They come in because there's some sort of occlusion of blood flow, and if you think about it, all the body does is it struggles to keep blood flow to the brain. So it's a really tough thing. If somebody has a stroke, they're burning 32,000 neurons a second.
Wow.
Their brain ages 4 years in 1 hour. To think about that. So everything is time critical. If you think about it, a stroke affects the organ you think with.
Right.
Okay.
Right.
And so you may not be realizing you
You're
have
not
a stroke.
recognizing it yourself. You may have to have someone that you're with,
Yeah.
a family member, a coworker,
Ideally-
husband, wife.
Exactly.
Yeah.
Exactly. And as long
What
as
are
somebody's
those
around,
signs or symptoms? How does a lay person know what the signs and symptoms are?
a lay person would look for sudden onset, and the key is sudden onset of abnormal behavior in their loved one. And we can sit there and say, okay, well, you're weak on one side, or you're weak on one, you get a facial droop, or
Right.
or your arm droops, or your leg doesn't function well. But often the signs are much more subtle. You can develop a visual loss.
Yep.
You can develop cognitive difficulties. So really abnormal behavior, inability to speak, things of those natures, and just fundamentally, I just want you to think about acute onset of abnormal behavior.
Sure.
Of some sort of type, and it's probably referable to the brain,
Right.
where it doesn't work quite as well, and usually your spouse will spot that in about 2 seconds.
Right. I mean, it seems overly complicated when people are thinking, oh boy, this is the brain, and it's the cognitive piece of someone. But if someone knows you well enough, they're going to realize something's not right. Something's not right.
And you're at a deficit if your spouse is trying to talk you into the hospital, and you're refusing to come and saying, I'll sleep it off, and you can't afford to do that. You've got to get it checked out.
We'll talk a little bit about getting to the hospital in a second. One thing before we do that is, again, not comparing cardiology and neurology or neurosurgery, but one way that your industry may have gained in that kind of that timing gap is your move, the industry's move to a little bit more non-invasive and more catheter-based procedures in terms of, 15 years ago when you had a stroke, it was catastrophic. There was major surgery involved. Now, a lot of it is catheter-based, much more medication-based. Neurology is way up front as part of the early onset and diagnosis process, correct?
Yeah. It's a team approach, and it has to be a team approach. It is neurology, neurosurgery. We have a stroke cardiologist here. The nurses are trained, the physical therapists are trained, the occupational therapists are trained. It's an amazing process that we constantly hone day in and day out, just trying to get every little second of time that we can. One of the things that we're moving forward is what's called a 4D CT scanner. And that'll be in within the next couple of months. It's going to revolutionize what we do in terms of speed.
And what does that mean for the average person? So why is that so important, that type of equipment?
It's incredible because now when you go in on a CT scanner, you can get thrombectomy on that CT table where you couldn't before. So we had to, basically do the study on the CT table and take you directly upstairs to get the thrombectomy, which creates delays. It creates seconds of delay.
Again, and you're working on time as brain this entire time.
Exactly. And so having this 4D CT scanner means we bring the neurosurgeons down into the CT scanner and they do things.
Sure. So you talked a little bit about the team concept. You talked about all those different disciplines working together. Let's talk a little bit about the Gates Vascular Institute, which has become not only renowned here in Western New York or upstate New York, but really world renowned. And we've had patients come from all over the world to be treated here. We've trained an awful lot of physicians who have taken that knowledge and moved it out to their respective places across the country. So talk a little bit about the uniqueness of the GVI and how you guys are really making these advances here.
Yeah, the Gates Vascular Institute we take it for granted. We don't quite understand the concept of having cardiologists, neurosurgeons, interventional cardiologists, structural cardiologists, EP cardiologists, and neurologists all in the same building, bumping shoulders. The synergy from that's been proven since it was brought in is amazing, and you don't really recognize that other people don't have the same situation.
And that's not just here locally, but that's across the country where they just don't have a center like that. But talk a little bit about the local dynamic. There are areas where they're designated by the Department of Health as stroke centers, but really can those outlying or community hospitals compare or compete with the resources that the GVI has put together and all that knowledge?
They can't. And what we're trying to do is understand the role of a hospital somewhere down in Pennsylvania that's a standalone emergency room, and exactly what they should be doing, and whether to have the patient bypass and come directly here, or to go to that hospital briefly and get treated and get up here. And it's a hugely developing area in EMS transport, and it's a tough problem. If somebody has a heart attack, you throw an EKG on them,
and they're coming to the cardiac center,
and you can read the EKG or send it off and do something like that. With a stroke, the patient's denying they're having a stroke. You have no way of evaluating them fully. And we're trying to develop the best way to get people to the best care as fast as possible.
And the moniker, the statement, the quote often is "Get to Gates." I have a personal story that you're connected with someone in my family, getting to Gates and making sure that they get there on time and get the best care. Talk a little bit about what the "Get to Gates" slogan means.
In terms of "Get to Gates," it means simply that. What people don't often know is they can look at your EMS personnel and say, "I want to get to Gates." Simple as that. and they got to take you.
Right. Right. It's the family's decision.
And you know New York State says go to the closest stroke center. What we're finding is they need to get to Gates.
Sure.
It's as simple as that.
Sure.
And the biggest tragedies we see is where people are not treated properly and then get to us and it's too late for us to do anything.
Sure. So in wrapping up, it's May, it's Stroke Month. It's an opportunity to thank the staff that you guys work with, the physicians, your colleagues, but it's also an awareness opportunity. So if you can, what would you leave us with in terms of advice, or what you'd want the general public to know about Stroke Month and why that's important?
If you look at our door to intervention times, they can be as low as 12 minutes. We are so fast when they get here.
Sure.
What we have had little or no impact on is the time from the onset of symptoms to getting here. And
fighting through the stubbornness or the awareness of someone may be in the onset of a stroke.
Exactly. And so that's so important. It's just to kind of just have that index of suspicion that something's going wrong, something's happening, and it happened acutely.
Sure.
And you need to get here. We've developed a pediatric stroke program here for ages 12 and up. People don't recognize that their kids are having strokes.
Wow.
And they are.
Yeah.
And that, if you think about it, that disability is lifelong.
Right. Right.
Yes, it takes effort to get here, but get here and we can do so much.
Sure. Dr. Sawyer, thanks for joining us today. Thanks for all that you do. Great talk on stroke awareness. Enjoy Stroke Month.
Thank you.
Thank you. I'm Mike Hughes. We'll see you next time on Medically Speaking.